My name is Erika Ehlers. I'm a nurse practitioner with Essentia Health Hermantown in family practice. So the difference between wildfire smoke and regular air pollution, or air pollution we see on a more regular basis, is that it can be much more caustic. The particulates in the air are not only exhaust smoke that we're seeing, but trapped chemical particles that are being seen, in addition to, of course, tree smoke and things that we'll see with forest fires in general. What we're seeing short-term wise is anything from dizziness, headaches, feeling like cough, shortness of breath, wheezing. Those are some of the main things that we'll see with short-term side effects or from the air quality issues. Long-term effects, if we have long exposures for this, what we're seeing is development of things from like asthma to COPD. Even certain types of lung cancer have a relationship with long-term effects of poor air quality. So there are a couple that with poor air quality are at higher risk. Children, those younger than the age of 10, and then older adults above the age of 60. There's also certain high-risk population groups, those that have already underlying heart conditions, respiratory conditions, as well as things like diabetes. Symptoms we should be on the lookout for certainly are shortness of breath, increased wheezing, coughing, feeling chest tightness or chest pressure, especially if those are being sustained after you've been in an indoor space that does have good air quality or good air filtration to the area. When they are starting to experience symptoms that are significant, they're longer lasting, they're feeling a lot of chest pressure, chest tightness, dizziness that is being sustained, having issues where that shortness of breath is really not resolving after they've been in better air quality, is when we would want people to seek out medical care. Yeah, so best ways that we can protect ourselves is, of course, limiting air exposure, or outdoor air exposure, I should say. If you're going to be outdoors for long periods of time, wearing N95 or KN95 masks are going to be beneficial, help filter out that air or pollution and caustic material again. Best way is certainly simply limiting yourself outside, but then definitely indoors, having something like a HEPA filter available, or certainly being in a place that has air conditioning, whether it be at home, or if you don't have it at home, being in a public space that has plenty of air conditioning to go around. So devices that are going to be really helpful indoors, certainly air conditioning, as that can filter out and provide clean air, as well as HEPA filters. So those are filters or air purifiers that are going to basically take that particulate out and allow for fresh, clean air to be circulated around your room, home, space, environment indoors. So really important in Duluth, of course, we love our hiking, we love our festivals, we love anything outdoors that we can get in the summertime. Some of the biggest things is knowing your limits, knowing when you're starting to have symptoms, because we certainly don't want you prolonging things outdoors. Get in areas that are indoors that have plenty of air conditioning in them, and just staying safe, again, knowing your limits and seeking out that medical care if you feel like something is not right.